Congratulations on the birth of your baby. I know this is a very exciting time for you right now. I'm recording this video to explain steps you can take from now until you're fully healed to not face any postpartum complications. There's something important I would like to discuss with you in this video as well, and that is about postpartum hemorrhage. I will first start off though by educating you about postpartum diet, activity, medications, and follow-up appointments, and when to notify your provider. For diet, as a mom to an infant, much of your attention will be focused on caring for your infant. You will be tired and fatigued, which may make you not think twice about eating fast food frequently. I do want to urge you to try to eat healthy though. You should eat a well-balanced diet. This is not only for your own health, but the health of your baby if you plan on breastfeeding. Every day you should eat a variety of fruits, vegetables, protein, and dairy. The fruits and vegetables are a good source of food for you to eat because it contains a lot of grains, which help with constipation. Amy, since you received a laceration during childbirth, any bearing down can cause you a lot of pain. Any fiber you intake will make it less painful for you to bear down during a bowel movement. The protein you intake will help your body recover from childbirth. I will also urge you to stay hydrated and eat enough food if you are planning on breastfeeding. When you are pregnant, your body loses muscle tone. I am sure you will be eager to start moving around and exercising. You need to remember though, your body has went through changes during your pregnancy. For instance, your joints are not as stable until 6 to 8 weeks after you give birth. Although you should not start vigorously exercising right when you deliver your child, it is okay to slowly ease your way into exercising. You should be okay walking a few hours after delivery. Walking is a good form of exercise as long as you do not perform any jumping movements because joints are still weak. I would still be careful though if you walk. You may have lost a lot of blood after delivery and your body may take a few days to adjust. And do not ambulate if you feel dizzy or weak. There are certain exercises I would urge you to begin. The first day after delivery, you can start pelvic floor exercises. These pelvic floor exercises are also called Kegel exercises, and they are performed to strengthen your pelvic muscles. By the second week, it is okay to begin abdominal, buttocks, and thigh toning exercises. For the first few weeks, you can perform abdominal breathing, head lifts, modified sit-ups, double knee roll, and pelvic tilt. As you perform exercises, you will notice your body getting stronger and you'll be able to perform the exercises longer without exhaustion or pain. If you experience any increase in vaginal bleeding, slow down exercises. When you start to bleed when you exercise, that often means you're overexerting yourself. When it comes to sexual activity or having anything in your vagina, you should wait 6 weeks. This is because you have a laceration from your delivery and the wounds need to heal. When it comes to medications, I do want you to not be surprised if when you go home you still feel abdominal cramps for a few days when you're home. This is normal and is only a result of the uterus contracting. Contracting helps bleeding to stop and for the uterus to return to its normal size. If you start having pain when you're home, you are able to take Tylenol every 6 hours as needed for pain, or Motrin 600 milligrams every 6 hours. These two medications are safe to take when you're breastfeeding, and you can take them at the same time. Even though you already delivered your baby, you should continue taking prenatal vitamins. Both you and your baby need the content that the iron contains. If you are breastfeeding, your body needs to have enough folate, DHA, vitamin D, and iodine to be passed on to the baby through your milk. Folate also contains iron, which would be good for you to take after having childbirth. During childbirth, you lost blood, and the iron will help to replenish your supply. You will also be given Docusate sodium to take as needed. This is a stool softener that will help you if you feel like you are straining to go to the bathroom. Since you do have a laceration from your delivery, it is important for you to keep the genital area clean so it does not get infected. Every time you use the restroom or change your pad, you should use the peri bottle, which has warm tap water in it, and spray it over the perineal area. You can also use witch hazel pads on the perineum to reduce swelling and pain on your laceration. You can also use witch hazel pads if you have hemorrhoids, if you have any. After you are finished going to the bathroom, make sure that you pat your perineum dry. Call your provider for one complication that can arise in postpartum is infection for a variety of reasons. The infection can be caused by infection in your uterus called endometritis, which could also cause PPH, postpartum hemorrhage, which we will discuss later. It could also be a UTI, which you may feel burning when you urinate. If you start feeling chills, pain when you urinate, or a temperature of over 100.4, you should call your provider. If you're having pain in your abdomen, perineum, or calf that is not relieved by Tylenol or NSAIDs, you need to call your doctor. You're concerned about the pain. We are concerned about the pain in your calf because it could be a blood clot. Another complication that can arise postpartum is depression. You may experience sadness and nothing makes you happy. Now, this is a medical problem that usually is a result of drop of estrogen and progesterone after delivery. Call your doctor if you experience depression. You may have been told not to be concerned about preeclampsia and eclampsia during delivery, but you should know that there's still a risk of getting preeclampsia after delivery. If you have any swelling in your hands, eyes, or face, and severe headache or vision change or seizures, this could be a sign of preeclampsia. And you need to call your provider and call 911. If you have any shortness of breath or chest pain, call your doctor, call 911 because it could be a blood clot in your lung. I hope you have no complications that arise from your pregnancy. If you have no complications, you should have your first follow-up appointment with Michelle Owens in 6 weeks. At this meeting, your doctor will make sure you are recovering well and answer any questions that you may have. But if you have any complications that arise, you should call your doctor. There is one condition I would like to focus on with you, and that is postpartum hemorrhage. Postpartum hemorrhage is one of the leading causes of maternal death in the world. It is not just a complication of developing countries. All mothers have the potential to suffer from PPH, whether or not they have any risks. If you do see blood after delivery, do not become too worried. It is normal for a woman to lose some blood after delivery. We become concerned when there is a lot of bleeding, usually more than 100 mLs, that could put a woman in a hemodynamically unstable state. To understand PPH, you need to understand lochia. After delivery, there's always a normal amount of bleeding. This bleeding we call lochia, and it could be assessed every time you go to the bathroom. You need to note the color, odor, and if you have any clots. The first few days, you will see dark red blood. This will be the heaviest, and it will be called lochia rubra. From day 4 to 10, you will notice the bleeding getting less, and it changes color to pinkish brown and called lochia serosa. The last stage of the lochia is called lochia albaneum. You will notice a whitish yellow discharge lasting 10 to 28 hours. If at any time you notice the lochia is pink or yellow and then turns dark red again, you need to call your doctor right away. This could be a sign of postpartum hemorrhage. Any woman who has delivered an infant can face postpartum hemorrhage up to 12 weeks postpartum. So statistics show that Asian and Hispanic women are more likely than other ethnicities to face PPH. Most hemorrhaging happens within 1 day of giving birth, which is called primary PPH, but you should be aware of secondary PPH, which can happen 1 day to 12 weeks. Common causes. There are a number of reasons why postpartum hemorrhage may occur in women. One of the most common reasons are uterine atony. Uterine atony is when the uterus does not have enough muscle tone to clamp down on the vessel to stop the bleeding. Uterine atony can be caused by the uterine being overextended during the pregnancy from multiple gestations, fetal macrosomia, and hydramnios. I do want to mention the importance of urinating after delivery. The cause of having a uterus atony can mean that you have a distended bladder, which could displace the uterus from the midline, making it harder for the vessels to constrict and stop bleeding. After delivery, many women do have the cessation of urinate, which could cause a bladder to become distended easily. This is why it is important to try and urinate frequently. Another cause of bleeding is having placental fragments left in the uterus. This is one of the causes of secondary PPH, which is bleeding from 24 hours up to 12 weeks after delivery. Uterine atony can occur when placental fragments are left behind. Giving birth may cause trauma to the perineal region. The trauma could cause bleeding after delivery if it is a large laceration. Lacerations can also cause perineal hematoma form that can cause a lot of bleeding under the skin. Other forms of trauma can include uterine inversion, which is when the umbilical cord is pulled during delivery. There are more people who are at risk for PPH, and those are people with bleeding disorders, such as thrombotic thrombopenic purpura, which is an autoimmune disease that causes platelet destructions. Von Willebrand disease is another bleeding disorder that can cause prolonged bleeding. Infection is another cause of PPH, which is another cause of secondary PPH. This is why it is important to monitor your temperature. Endometritis is the infection affecting the uterus that if it occurs, it will make it more difficult for the uterus to contract and may cause hemorrhaging. One major sign that you're experiencing postpartum hemorrhage is your lochia will get heavier and red. Normal bleeding should get less and lighter in color as time goes on. If your bleeding goes back to dark red like it was right after delivery, then you need to be concerned. Call your doctor right away or 911. If you're having PPH, you may start not feeling right. If you are bleeding, you may start feeling dizzy and lightheaded. You may start feeling cold, clammy, and turning pale. You're losing blood, so you may also be fatigued and want to sleep. If you continue losing blood, your blood pressure will drop and your heart rate will increase. Anytime you have PPH, you need to take it seriously. You can lose blood very quickly, causing your blood pressure to drop and face complications caused from hypovolemic shock. If the blood is not controlled, shock is your body not perfusing adequately. If organs in your body, such as your kidneys, do not receive enough blood, you will have end organ damage. Like we mentioned before, anyone is at risk for PPH, but there are some people who are more at risk. If a woman has an over-distended uterus during birth caused by multiple gestations or polyhydramnios, this can lead to uterine atony. If the uterus becomes exhausted from prolonged labor, it may have difficulty contracting. If you had gestational hypertension or preeclampsia causing high blood pressure during pregnancy, this may make it more difficult to control bleeding. There are only a few of the risk factors there are more that will put a patient at risk. These are only a few. I know this was a long video of educating you about medication use, activity, when to call 911, and also about preeclampsia. Now that we are finished with this video, I would like to go through all the categories we mentioned and make sure you understand what we just covered. I want to ask you a few questions. Make sure that you understand the material. First question, what pain medications do you take when you are in pain? Second, what type of exercise can you partake in when you get home? And what are some methods you could use to strengthen your pelvic muscles? Third, what type of foods would you eat when you were trying to recover from childbirth? Fourth, when is your next follow-up visit? Fifth, what complications will arise that will lead you to call 911 or a doctor? Sixth, what is PPH? Seventh, describe bleeding that is normal after birth. Eighth, question, when should you be concerned about bleeding? Ninth question, what are complications of postpartum hemorrhage? Once you have verbally answered these questions to me, I know you understand what I taught you. If you are having difficulty answering these questions, I will go over the questions with you, then have you repeat back what I have said, and have you answer the questions again.